This is an orthokeratology case based on a simulated topography that the software creates based on parameters that you enter. And the concerns in this case are that the patient is not seeing well until after a couple hours post-lens removal in the morning. The lens fits tight overall, and except in the vertical meridian where the edge seems a little bit loose. So as far as the blurred vision in the morning, if you're not seeing any physiological changes to the cornea, then most likely the patient is just a little bit overcorrected. And with this refractive error and this power, that's probably what I would guess. So we can back off on the power here and drop this down to maybe a 125, give ourselves a half diopter. So this slightly steeper base curve will correct a little bit less, and that should give the patient slightly better vision in the morning. Of course, if the patient has really clear vision late into the evening and wants to preserve that, this might not be the solution, as the patient might find that although vision in the morning is better, vision very late in the day might be a little bit worse. So you can titrate this power as you manage the patient and what the patient desires. As far as the tight lens goes, if tight meaning difficult to remove in the morning, I usually will just help the patient with some tips in terms of more ease of lens removal, but in many cases, a tight lens or a lens that binds a little bit is favorable for ortho-K because we get a more consistent treatment. But addressing the edge lift vertically, I think, is a good idea, especially since there's some cylinder here, and it appears that a lot of that cylinder is carrying through even after lens wear. So to tighten the single meridian, we want to go to 50% mode. We're in GSIM, so we can do this in 50% mode. And I think a reasonable amount to change is 12 microns. So if you look right here, we're at a sagittal depth of 735. So we want to make this 747. And one more. So after a few clicks, if you hover over again, we'll see we're right around 12 microns. Maybe go one more. And that puts us one over, but that's okay. So that's how we would tighten the lens vertically. Because it's a GSIM mode, you only have to do it in one quadrant. It mirrors to the opposite side. One other thing I'm looking at is if the binding or lens adherence really is an issue in the morning, one thing you can do pretty easily is just increase the edge thickness, and that should get the lens to be a little bit more loose in the morning. So those two changes should address the issue with the vision in the morning as well as the lens fit on the eye. So hopefully that's helpful. Best of luck with your patient.